Maybe I can get started by asking you briefly introducing yourself and you could explain your career journey and how you got to where you are right now and what do you do in current role. Start with Kristen.
Hi everyone, my name is Cruz. I am a freelance science writer, and I have a PhD in biology from UC San Diego. I did not do a postdoc. Right afterwards, I moved up to San Francisco, and I was a recruiter for a while because I did not know what I wanted to do, but the thought of being at the bench any longer just gave me huge anxiety. I didn't have the greatest experience. So I knew I needed to get out, but I didn't know what I wanted to do. So as a recruiter, it was nice because it was specifically for the biotech industry. So all of the jobs came to my desk and I was able to see what was out there for me. And that was actually a really rewarding job. I got to place a lot of people in some really good positions, and I would get thank you notes months later because they were really happy with the job. And I ended up, after that, going into public relations. It was very different. I wasn't being paid very much because I had zero experience, but again, it was a company that was only had life science companies as clients. And so I would have like 7 different clients at a time. If you don't know what public relations is, I can explain it to you later. Well, quickly though, it's sort of selling a story to the media, to a writer, a journalist, and letting them know that, hey, there's this cool company with this really neat instrument. Do you want to write about it? That's kind of the gist of public relations, which I did not like. As a scientist, you want to be doing the science a little more. You don't want to be selling the science necessarily. But I did go into marketing, which is another salesy type position. But at least in marketing, I really got to learn my product really well, which was in digital PCR at Biorad. And I got to really learn about advertising and what that means, and going to conferences, and how much everything costs and how much we spend on marketing. And that's kind of where I got also my start in writing. I was doing writing flyers and website copy and stuff. And then I moved back down here, and I wanted to start trying to have a family, so I needed a more flexible job. So science writing kind of fell in my lap, and I started writing for magazines. So I was the journalist for a while, and that was really fun. But I quickly kind of moved on to doing more writing for marketing groups within a bunch of different biotech companies. So like I've had 15 clients over the last 2 years. I've written a lot of blog posts. I do flyers, I do website copy, I do technical notes, like application notes, and all kinds of writing. And it's really fun because every project is new and it's a different subject. And so I get to kind of be a student again and learn all about this. Like I was just telling her about this one about organoids that I've never worked with organoids. I didn't know what organoids were, but now I can tell you a lot about them and how they're created because I had to write an article about it. So that's kind of the best part of my job.
Hi, my name is Margaret Fish. I did my PhD at University of Virginia in cell and developmental biology, and then came out here to UCI to do a postdoc in the lab of Ken Cho here, which is developmental biology lab. And a couple years into it, I never really had like a clear idea of where my career was going, but I always kind of figured I wasn't going to end up running my own lab. And I attended an event, like maybe this, an event almost exactly like this one about 4 years ago, and that was when I first started learning about what medical writing is, scientific writing, and learning about the career path, and started thinking about it. And as a postdoc, you're doing a lot more writing. I was spending a lot of time working on manuscripts, but also a fair amount of time in the lab, and just thought that it was something that I would like to pursue. So I'm still pretty early in my career. In July, I'll be 3 years at my first industry job at Edwards Life Sciences as a medical writer. They're a medical device company that makes primarily artificial heart valves and other cardiovascular medical devices, which is completely, like, not at all connected to my area of research or any area of expertise that I have. So it was a pretty interesting transition. And the type of writing that I do there is mostly regulatory clinical writing. So I work for a clinical affairs department, and they have to send reports to the regulatory agencies, whether it's FDA or European regulatory agencies. It's mostly what I work with, and then we have different groups that handle, let's say, the Chinese regulatory agencies or something like that. And so I work with their clinical data and put together the reporting that needs to be submitted for regulatory agencies.
Hi, my name is Nana Sinatra, and I actually got my PhD here at UCI in pharmacology and toxicology. Shortly after that, I started a USC Allergan Fellowship, which I highly recommend to all of you. I would say probably apply 9 months before you plan to graduate. You have to, I think, finish your by July or June of that coming year, and the applications are in December, so something to put on your calendar. Let me tell you a little bit more about that fellowship, because it basically started my career. So I decided that I wanted to do a PKPT fellowship at Allergan. I wanted to actually do it in Botox neurology. They're like, hey, we really like you, but we're gonna put you in eye care in retina, which is very different from my PhD degree, although I did, the pharmacology was there. So I transitioned into that position and loved it. I learned a lot. I really became close with all the research at Allergan. And then I actually started thinking about medical writing as well on the side, which I had started way back when I was doing my PhD. I had started working, wanted to, give me an opportunity to write for her, and basically take some of the jobs that she had a lot of and train somebody. And so I was really fortunate being able to get that opportunity. So writing was already there in my head, and then I had started contacting people on LinkedIn, on to panels like you do, and really started doing my research on it. So after starting the fellowship at Allergan, I started applying for a medical writing position that had opened up at Allergan. Didn't really think that it was going to be something that I would get because of all the experience that was required on the application.
I do.
Julie was actually one of the people who was working in publications and was like, hey, go get lunch with, the writer, your internal. You can kind of ask her and, let her know that you're, and that worked out really great. And so that manager, actually, I had interviewed 2 years before when I was doing my PhD and asked her about her route to where she was. And she'd recommended the USC Allergan Fellowship, and I kind of checked off all the things on my list that she had recommended. And sure enough, 3 years down the road, I was interviewing with her. So anyways, that worked out well. I'm there. I'm in eye care. And I'm a medical writer, mainly in publications. So that means I do a lot of the things that you guys are all familiar with, which is writing an abstract for a scientific conference, making a podium presentation. You guys are probably all familiar with PowerPoint and things of that sort. And then also working on manuscripts, which you are, if you haven't already worked on it, you're probably most likely going to be required to do at least one before you leave. So that's essentially what I do, but I do a lot of other things outside of that help the actual publications group as well, like interfacing with patients or through patient life summaries, and then also working with kind of a whole span of preclinical phase 4 and beyond. So not something that I got the training in grad school, but I was able to learn one thing from grad school, which was persevering and working hard, and that goes a long way.
I just want to say a funny story about Nana. Her PI, or my PI, was on her committee, and he said I was a bad influence. Yes. Anyways, okay. My name is Dela Cruz. I got my PhD Well, the first one in neuropsychology, University of New York, and the second one in neuroscience in Maastricht University in the Netherlands. And then I came over to Irvine to do a postdoc in the Department of Anatomy and Neurobiology under Shengmin Xu. So I actually wasn't really liking my postdoc because that wasn't the purpose. I just needed to pay my bills. So and the reason why I didn't get an industry job is because all I did was apply online because I didn't have the resources you guys had. Like Verinder gives GPS-BIOMED, that you have to network and you have to talk to people and you can't just apply online. So that's not the best reason to get a postdoc, but I did have loans I had to pay, so that's why. But the postdoc did lead me to GPS-BIOMED, and that taught me how to do things correctly, and I might have influenced Dana a little bit, maybe.
Yeah, so Julie and I worked in the same building. She worked downstairs, I worked upstairs, and we would commiserate about our situation.
Yeah.
So you never know who you run into and who you end up working with. So.
Yeah, so my job is different than the rest of them because I do not write at all whatsoever, and I will never write, and it's not a thing for me. Which, if you really, really have to love writing to be a writer, I did it because I had to. But my job is actually more, I'm a publication manager in facial aesthetics, which is completely different from neuroscience, so don't be dissuaded by a different topic in a therapeutic area in industry than your actual PhD, unless you really, really like your topic. I didn't care. So my job is I take all of the preclinical, clinical, and post-marketing trials and make sure that they get into the right abstracts and the right conferences with the right audience, and also make sure that they get into the right peer-reviewed journals. So not only do I work with medical writers like Nana, I also have an agency that also writes many, many abstracts, posters, and manuscripts. So in the end, I think I help manage over, I don't know, like 300 or 400 projects a year. I don't do this myself. You also have a thing called an agency that helps you. But I collaborate with medical writers to make sure that they're in the right area with the right strategy, the right message.
Great, that was awesome. As you can see, I switched my seats because I also want to know what you're talking about. Maybe I can switch the question a little bit more. You describe your career journey, what you do right now. But what was the main motivation or the inspiration behind moving into that role? Because this is the role, something which not all of us always think about. We really dread that role of writing. But how were you able to overcome that hurdle after you decided that's what you wanted to do? Kristen?
It was funny, I kind of never decided for myself that writing was what I wanted to do. I quit my job at Biorad without having another job, and one of the people I worked with internally had recommended to one of the magazines that I write for them, so they reached out to me. They were like, hey, I was told that you were a good writer, which is funny because I didn't really write much. But whatever, I was like, sure, I'm a good writer, yeah. And so I took the job, so when you're on a freelance basis, it's just one job at a time. So they're not hiring you to do a bunch of them, it's just one article. They test you out, see how you are, and then you might get more articles than that. And it just kind of like, stuff just kept coming to me, and then I started calling myself a writer, and I was like, you know what, this is a really nice, flexible job. I can work when I want to. I can say no to jobs, which is amazing to say no. Because when you're at a company, you kind of can't say no to your boss. Like, you can say, no, I don't have time for that, maybe. But if he or she wants you to do another project, it's not really something you want to be doing. Can't say no unless you leave. And that was part of the reason why I left Biorad, because I didn't like part of my job. So anyway, it just kind of like fell into my lap, and now it's become fun. And like you were saying about how you have to love writing to be a writer. I don't totally agree with that. I don't love writing, to be honest. It's still a challenge. It doesn't come easy to me. I was never like a good writer, so I'm still working on it and still getting better. Now it's comes a lot more naturally because I've been doing it for 2 years. But at first it was difficult a lot of time to write. But anyway, I'm happy with it for now, but to be honest, I don't see myself.
Yeah, I love being a postdoc. I probably still would be at my postdoc position, but I started a family, and just the work-life balance of life in the lab, and just to be frank, the compensation trying to live in Southern California, it wasn't working. I just realized that it wasn't working and that I needed to go into industry to pursue something that I perceived as having a better work-life balance, and we all know it's going to have better compensation. And I also, at the time, I thought, well, you know, I like working in the lab. I like designing experiments, and I also like writing. I kind of thought it was 50-50. I thought I could do writing. I didn't love writing. I think writing is hard for almost everybody. But the other thing that I perceived was that there was less competition for medical writing jobs. There weren't that many people that wanted to do it. I think a lot of scientists hate writing. So I thought, well, this is something that if scientists wanted to get in an industry, most of them are going to want to go to the bench. So it'll be a little easier for me to find a job if I try to do writing, which I don't hate. And then in talking to my other medical writers, there's the fact that there's a flexibility to writing because you can do it from home. A lot of writing positions are partial or 100% remote. So I thought, okay, there's going to be job security and a work-life balance. And so that's why I decided to medical writing. And the reason I didn't choose regulatory or publication, but just kind of the first offer that I got that was acceptable to me happened to be in a regular writing position. But now I think I actually really prefer regulatory writing to manuscript writing. So it's something that and that's also thankfully fewer medical writers I think want to do regulatory writing because it's really dry, it can be really boring and technical. So I guess I try and find the path least taken because I figure there'll be less competition. And that's how, that's how I got where I am. Yeah.
For me, I think writing really started when I started my master's. I did my master's at Long Beach State. I graduated from UCSD, had worked as a technician for a while, and then decided I was tired of getting the crappy jobs in the lab, and I wanted to design experiments. So I ended up taking my master's. Along with that came writing, and writing for grants and things of that sort, which I had no idea, I had zero experience in, and was really fortunate to get a great mentor who said, look, write it, you just throw it out on, puke it out on the page, and then you refine it. That's what you do. You put on your writing cap, and then, take a break, and you come back and put your editing cap on. And I took that to heart, and I applied for everything under the sun, and I was able to get a good amount of the things that I applied for. And it was not just all me. It was basically peer review and getting feedback, which is so, so important. I carried that on in my PhD. I was actually able to get a predoctoral fellowship starting at UCI through a Sally Casanova predoc fellowship, and basically continued that in graduate school. I have to echo what you guys said. I did not love writing. I fell into it, and then I found a pattern, and I could tolerate it, and I actually started liking it. It's really nice when you work really, really hard on something and, you get an award or, you get recognition. So I really started to like writing. And throughout my PhD, continued writing, applying for everything under the sun, partially because I worked in a lab that did not have very much money, which is always a important incentive to get funding and seek out those awards. So after that, I just kind of decided, I don't know if it's writing that I want to go into or work as a postdoc at the bench. And Julie was like, oh, you should just try out writing, go ahead and see, seek out people. So I was kind of doing that on the side, and I did some small stuff for a freelancer. But when it came to graduating, I had actually accepted a PhD at like an amazing lab at UCSD, and then I got the okay, and yes, we're gonna cover your moving costs to San Diego. And then I heard back from the fellowship that I had applied for like 9 months before, and they're like, would you be interested? Can you come in for an interview tomorrow? And so, it was within like 3 or 4 days I had to decide, do I want to be a scientist at a research institute or at, for a 1-year short-term thing at a company? And I figured kind of risky, but I'm going to go for it because I haven't experienced this, and I think this might be really good for me. And then from there, I realized that I did not want to be at the bench. Definitely in industry, it's all, it's way better paid than it is in academia, but it's just as intense, and your schedule is not to be made by you. So that was the one thing that I think took me away from it. And then the thing that I was really drawn to was medical writing, because I still like tinkering around with a story, in terms of coming up with a manuscript and an idea or the topic for a talk. Those are the things I really enjoyed, and so I think that really pushed me to that and Julie, to apply for this position and go from there. But I had joined American Medical Writers Association long before, even when I was a postdoc, just to kind of get a little bit more information. But, definitely taking a risk, I think, is why I ended up where I did.
Dana's inklings were there. I just kind of just went, go. Okay, so I'm the fish out of water in this one. So a recruiter actually approached me for the publication manager position, which I looked at the first one, and like the first word said publication. So I asked the recruiter, I said, how much writing is it? And he's like, none. I'm like, sweet, I'm in. Because they said they don't hate it. I abhor writing. Like, no, I will not do it. I went through my entire postdoc without writing anything because I just kept pushing it off. I said, I'll get to it later. And I was hoping like maybe I'll find a job before he bugs me again.
That's not true. She published like 6 articles or something.
In the postdoc, I didn't publish anything. I published an article that was already written, and I just edited it. What I was looking for was a job in medical communication. So I was looking, like, for example, an MSL position, which is very hard to get, or
Medical science liaison.
Yeah, sorry, yeah. Or med info, or anything in medical affairs. And publications is also in medical affairs, and that's communicating science through the written word. So this is still on my path to still be somewhat in medical communications without the writing. So I'm the different one.
So if I can ask you now, compared, you talked about grad school and postdoc writing. If I could ask you, what's the biggest difference you see in your current writing compared to writing during grad school and postdoc? And I know, Nina, you sort of like talked about it, but if all of you could like stress on like what fraction of work is that compared to grad school, postdoc?
Sure. So what is the same, I guess, is when you're writing a publication, there is a story that you're telling. And that's you always keep that in writing. There is always a story that you're telling. But what's totally different is most of the writing I do doesn't necessarily have data. So I could be writing something for a website. And what I'm really trying to do is convince the reader to think something. And that's what I learned in marketing. And that's something you don't really learn, which would be really useful though. It should be taught during grad school, but it's not. Because it would help if you could, while you're writing your manuscript, okay, what is the reader thinking right now? What do I want them to be thinking? So I do a lot of that kind of writing now. It's very different, and I use a lot of colloquialism. So I have to, dumb it down a little bit because a lot of the stuff I do is blogs, and you want it to be read by a partially lay audience, like an educated lay audience. So I'm not going to be using all the technical words that I do, or I'm going to be defining them within my writing a lot, which is, it's good for me because it allows me now to communicate something super technical, like with my mom. She can understand that kind of stuff. That's kind of what I think of when I'm writing. Like, is my mom going to get this? At least mostly, so.
Yeah, so type of writing I do is like on the other extreme from what you do. I would say that the biggest difference between, so the writing that I did as a postdoc and in grad school, of course, manuscripts where you're talking about your own data, and the circle of stakeholders is really small. It's like you and a couple of people in your lab that you worked with to do the data and plan the experiment, and your PI and maybe a collaborator in another lab. But for now, like writing at a company, there are many stakeholders. So it's really broad, the number of people that are interested in making sure that the product is correct. You've got your regulatory stakeholders and the person that's in charge of the trial, and then there's people on a safety team, and maybe the biostatistician, and so I guess there's a really broad coalition of people that I'm collaborating with, and the production of the data, of clinical data, is also just huge. Like, it's on a scale that is totally different from when it's your own data, when you consider that you might have 1,000 patients enrolled at 100 sites, maybe 100 a lot, but 20 sites in the US and in Europe, and the data's being entered into computers and it exists in a database. You can't just find something that's wrong and fix it. To find something that's wrong is to go, there's a lot more process, I guess, in everything. And so understanding the process and following the process is really, really important, and documenting everything is really, really important. So I think that's the biggest thing that's different in my experience in industry writing, like academic manual writing. Yeah, and you are still telling a story, but you pretty much are telling the same story every time when you're doing the type of writing that I'm doing. The story never changes. It's mostly like, hey, FDA, this product is safe and effective. That's always the story. So you don't have to think too much about a different story. It's more about making sure that you are writing clearly and concisely, and that the data is correct and that it all makes sense. The other thing I was thinking about that was really good experience for me in grad school and as a postdoc is reviewing. If your PI ever asks you to help them with reviews, because that's a lot of what I do, is basically I'm writing a document that the FDA is going to review. So I'm thinking like a reviewer. I know that they're going to take this year's report and last year's report and compare them and see what changed and is there anything to be alarmed about. So if you have any opportunities to review other people's papers, that is really, really helpful. I think whether you're writing manuscripts, writing the type of writing that I'm doing, is you need to be able to think critically and pick apart data, and it will make you a better writer, and it will make whatever documents better. That's better for the company, not have a bunch of questions back as for writer.
Definitely going to echo what Margaret just said. Take the opportunity to get the experience to review. Even if your PI didn't come to you and say, here's my latest grant, take a look. Be proactive. You go and you ask, say, hey, I want to be part of this. I know you guys have a million other things on your list. I understand, but do it, because it gives you a better understanding of, one, where you fit in on the lab, what your data is how it's going to contribute, and two, it's going to make you a better writer, better reviewer. So definitely take that opportunity. So your question was basically, how is it different in grad school versus in industry? And in publications writing, you're doing a lot of the same stuff that you learned, but it is way more organized. And I'm fortunate enough that I work in a team that has many writers, and so there's actually templates for everything. You know, I mean, it's not like the sentences are written out for you and you just plop in the data, but there's an outline that you do before you do your first draft, second draft, final, right? I never had that. I always, in grad school or when I was writing a grant, it's like, this empty page with this huge cursor that's blinking, and it's like, oh, what am I going to do here? So I would always, start off with like maybe bullets, but that was not something that I learned until pretty much at the very end of my PhD. Even though I was doing all these other types of writing, I would always start something and it gets stuck in like, this is not the perfect sentence. This is not, this is not the way I wanted to say it. So that's the one thing is like just learning to work with an outline. For example, in your introduction, what are the 3 things you want to convey? I usually use that. And then easiest thing to start on, and you guys might all know, is your methods section, because it's in a protocol somewhere. So just start with that. And then even if you don't have a perfect sentence for it, put the idea down. Don't worry about the reference. Just little things that you learn being in industry that allow you to get the words on the page and then worry about the details. And I would just always keep a pad next to me and say, all right, make sure you fill in this reference, or, figure out why this product it is relevant in terms of this disease state or whatever idea I come up with. But just sticking to a time, I'm going to give myself half an hour to come up with a bare bones skeleton outline, and then just going from there. And so I'd come up with a pretty good outline, do all my background reading, things like that, which is what I'm doing right now. But I didn't do in grad school, and I wish somebody had told me, like, hey, don't, it's not earth-shattering for you to hear that, I'm sure, and you're like, duh, but you get stuck on it, because you're so obsessed with your work and how, you portray things. So the process of that is so ingrained in grad school of just, making sure that you do things really well and perfectly. Not the idea is in the beginning when you do writing, get it out on the page and then, worry about the details. So I think that's the one big thing is industry is definitely more focused. You have to document everything, every communication, email, it goes into a special program because it's a liability. You as a writer, if you're putting something down, you need to make sure, yes, this was approved by the clinical lead. Yes, this is approved by the biostatistician. So attention to detail is definitely something there, but from what I know with scientists, that's not an issue. You're all kind of trained to do that. You might have, sloppy lab mates, things like that every now and then. You might be, that yourself, but when it comes to getting to, industry and doing that, it's just part of the job. You can't not do it. You get called out on it. And it's built into the process, so you cannot move from outline to draft 1 without a formal documentation of it. And your publications manager will hold you to that if you work in such a... And I'm sure even in regulatory, you get MEDRA, or you have like things that you have to fill in. Okay? So that is kind of built in. I'm trying to think what else is different in terms of the kind of writing I do. I think you just have to be open to different ideas. I think that's the biggest thing. And in grad school, you're taught to just be super focused on one thing, but you have to jump out of that, especially if you're dealing with everything from preclinical to, beyond. So that's the one thing that's really different in terms of how you think about the process of writing.
Great, Julie. Yeah, I have a slightly different kind of question for you.
Because my answer is none.
Yeah, no. I was going to say you do not do any writing, but you do manage people sitting on your right side, all 3 of them. So you're a publications manager.
Yeah.
What sort of transferable skills did you acquire during your grad training that you're able to do publications manager role?
Okay.
And are there any similarities to what you did before?
I learned how to be really organized, especially in my situation, because I was doing 2 concurrent PhDs at the same time, 2 different countries. So now you need to be really, really organized, or help people be really organized, even though it doesn't look like it on my desk, but I am organized. You need to learn how to ask people who don't report to you to do things. So you need to have a good working relationship. And in my PhD, I had a good working relationship with my PIs. My postdoc, whatever. But with that, you need to, you do need to be like, hey, this is due, but you can't be like, hey, do this now. It's just like, hey, when do you think you can get to this? It's due and in this conference on this date, so we should get this moving forward. So I learned how to communicate better. But a lot of that is through Bree's class and also Sandra Singh Lowe's class.
I highly recommend you take both.
You guys still offer that, right? Okay, good. So I definitely recommend taking that. In the actual PhD, I would say more of the organization skills, especially if I have to make sure that like 300 to 400 projects a year go through. It is all, I'm also all over the place, but a good all over the place.
Oh, you know what? I had one thing that I really wanted to highlight that I just thought of with that prior question that you had. One thing that I really learned in grad school that was really helpful, that's been really helpful, is kind of like micro editing. And so like take a look at say you're applying for a grant, take a look at someone's winning grant and break it down. Like put your little notes on the side of what are they trying to do? Kind of the same thing as what is a reader thinking at this point? And so that's what you want to ask as you go along, because that teaches you to be a better writer. And then essentially the winning formula is there. You just have to apply it to your work. And I think that was really important. And that's something I learned in grad school that's carried over.
Great. So I don't want it to be a session with just me asking questions. The house is open to anyone asking questions. If people are shy, then I did leave these cards there. Just write your question and hand it over to me, as one of the audience actually gave it to me. And it just happened that they stole my next question, but glad, one question less. So the question from the audience is, what are the different types of medical writing? But I did have another thing, so there's a difference between science writing and medical writing. If whoever is an expert could break that difference down. And within medical writing, how many different kinds of writing is there? You did mention regulatory affairs, other kind of writing. If you could elaborate on that. We don't have to go in any particular sequence, whoever wants to start first.
Yes, I mean, again, like I'm going to let them talk about medical writing. I do not do that. I do not call myself a medical writer or a technical writer even. Those are separate things. And they'll talk about, what also a technical writer means. I call myself a science writer on purpose because it's really, it's more of the marketing arm that I talked about before. So it's websites, flyers, brochures, but then also the blogs and the articles and interviews that turn into articles, stuff like that. So I call it more of like the fun type of writing, but again, it's more marketing based, and it's just very different.
That's the only 2 I know in the industry is a publication
That's like
writing,
the big break
regulatory,
medical writing,
If you're
like med affairs and regulatory.
Yeah, so in publications, you write manuscripts, which I guess gives a lot more freedom.
I think when you said it's more dry, I think you're hitting the point in that it's a little bit more formulaic, because it has to be, because you can't have these like, you know, oral like sentences in sections, or expand, because
Those documents are already long enough. You can't.
Yeah.
Right. There's no discussion section. You don't like have a section sort of like discuss what you think, not like that. Yeah, that doesn't regular writing, but
Yeah.
But like medical affairs writing also includes putting together podium presentations
right.
for physicians to present
Yeah.
at their conferences, script,
Mhm.
and like
Abstract.
would you consider like education, medical education,
Yeah.
or is that
Patient summaries. We don't.
like training, physician training?
Oh no,
That's
That's
Yeah,
marketing. Okay.
yeah.
Yeah. That's
And it's also depending per company too, because maybe in Edwards it is included. Right.
It can vary by industry
Yeah,
and by
have
company.
it organized differently.
Yeah.
And then, so I talk about clinical study reports, but there's other documents that you would produce as part of medical writing. So like literature reviews are really an important part of the puzzle, which, like, but and probably all of you either have or will, I assume, write at least one literature review. That's the first chapter, citation literature review. So if you're looking for a position as a medical writer, be sure to put that on your resume. I have experience writing literature reviews, because you do, or you will. But instead of the way I wrote my literature review when I did my dissertation, it was more like, just because I was an expert in the field, I knew all the literature and summarized it. But this is more like there's a protocol for how you write your literature. Like set up your search, and these are the terms, define it, and then you have to go through and every single one of the articles, read it, or just count it as being outside of the scope. And then you write up a summary based on the entire scope of literature but it's for a regulatory purpose. The purpose might be to compare an existing product on the market with the product that you're looking to get approval for, something like that. So regulatory writing is always within a framework of getting a regulatory agency to approve you to be allowed to sell your product in the country.
Yeah, I mean, I'm trying to think, cover any other I haven't really discussed, but at least in publications writing, I can tell you, especially in Allergan and our team, manuscripts, abstracts, podium presentation, maybe preparing slide decks for ad board.
Advisory boards.
Yeah, advisory boards where physicians sit in on, talking about a product and kind of go over that, maybe compare things as well. So I guess the other thing that is a little bit more interesting, I personally love, is patient lay summaries. So now it's going to be mandated pretty soon that if you participate in a clinical trial, you are going to get what is called a patient lay summary, which is going to explain what was the study, when did it happen, what were the results, and what was the safety and efficacy, things like that. Basically, a CSR, but for
Third grade level.
I think it's about sixth grade level. I love breaking down the time. I think it's so useful, and it's to an extent, you might think of it as dumbing it down, but digesting something so that it can be explained to anyone. I think that's empowering, and I think it's important, and I think it's really valuable to be able to do that, and it's a very useful skill to be able to do that. So
When you can get that at Sandra Singh Lowe's class too.
yeah, and you can get that at and I think it still happens, is Brews and Brains,
Oh yeah.
which I was a part of early on. Actually, we
Who's it-
set up
Who's in charge of that now? I think
Sarah Cross.
Yeah.
So if you guys get the opportunity, say, hey, I want to do a 15-minute talk on my work. It's really valuable. Yeah, I think that's a part of my job that I really, really am starting to love as well, because it's a gradient. You have science writers who do these amazing pieces on a wide array of stuff, and you have a little bit more leeway in terms of how you want to represent it. And then medical writers, are essentially doing more technical, well, a little bit more scientific technical writing. And then you have regulatory where, it's also really important, but is very formulaic, because it has to be by nature for it to be fairly by the FDA. So I would say that's probably a good gradient of it. I'm sure we're missing other types of stuff in there.
Another one I want to mention is called content writing. That's kind of what I do, is content writing. That's a job title if you were going to look for jobs, and that's really more of like a marketing role where you are developing what now is called, so content is sort of anything online or like something that you can pass out in person, but something that's going to get the attention of your potential customer. That's really like the point of content writing. And that's kind of what I think is more of like more fun aspect of writing work.
So you can't imagine how happy I feel that all the presentations and talks and writings I did for my PI, I could have gotten paid so much for it. I did thousands of those, didn't get paid much, pennies, but that's good to know. So another thing which came out of like during discussion, which didn't get specified, was the difference between an agency and an industry or company. What's that? They're working for an agency, writing for an agency or a company?
Oh,
What are the major differences?
For me, right? Yeah, okay. All right, so a pharmaceutical company is a pharmaceutical company where they develop drugs in order to help the patient. There's lots of different types of agencies. There's not even, but the agencies that Naina and I, well, actually mostly me, not really, that I work with are medical writing agencies, but they also have like clinical research organizations to run clinical trials, and they have like marketing help organizations. But I'll focus on our medical writing agency, which we use because we cannot produce those 400, like Naina can't do 400 in a year. Impossible. So we use these companies to help us, keep our accounts and keep everything flowing, because I also can't make sure all 400 go at the same time. I do need help. And they also have a team of medical directors and medical writers. So we basically pay them, it's like outsourcing. The difference though between a pharmaceutical company and agency is you, as an agency, you have to please your customer. So hopefully your customer is really nice. Sometimes they're really demanding, but it doesn't matter. You have to please the customer. So I would always say I hope I never work for an agency.
Yeah, I can attest to that because I did work for an agency.
Yeah.
And some of my bosses would get in fights with their clients because the clients have their own way of thinking, but you're the expert. So agencies usually are the expert at whatever that is they're doing, and they have lots of clients. But whoever you're working with, your client maybe doesn't want to listen to you. They think they're right. And so you still have to please them at the end of the day, and then talk crap. Like over in the corner. But I also, as a freelancer, work with agencies. So sometimes agencies hire me because they don't have an internal writer that can write technical stuff that they need for the companies they work with. So they'll hire me as a freelancer for those projects. So I still work with agencies. I still have to keep clients happy, but that's fine. I can
also say no.
I can always say no to those jobs.
Agencies
too.
can't
As a
say no.
freelancer,
True.
you get, a lot of do that. And I have to say, as an industry writer, you get that too. I mean, 400 manuscripts, and we decide in August what's going to work on what, and I get to take a look at everything and say, hey, I'm going to work on these projects and manuscripts, abstracts, podiums that go along with this stuff. So you get, essentially do get to work on things that you want to.
Then everything else goes to the agency.
Yeah. And even if you have to shift writing, for example, you have to meet a deadline for something or something comes up, you can just say, you know what, I started this, but I don't have the time to finish this. send it to the agent.
Because we have so much money. We don't. They're very costly too. So we do have to end up cutting a lot of like planned things as well. And it doesn't make people happy when you have to cut things. But you only have a certain amount of money you could spend. It's a lot, like in terms of I don't own that money, but it's also not that much because I think for a manuscript it costs around $43,000 a manuscript for the agency. Right? So Nana saves us every time she writes a manuscript. She saves us $43,000. I don't get to keep any of it though.
I have a question kind of geared towards the freelancing kind of aspect, because we're talking about paying the bills and things like that. So do you have any suggestions, even if you're doing that on the side, how do you maintain, financial stability, especially somewhere like here in doing that?
To be honest, I wouldn't recommend it for people who need money. Not at first. You really you need to establish yourself. So, I mean, the fact was, I came out of a really reputable company. I knew all the editors of these magazines. I had a reputation. I'm also huge on LinkedIn. Like, I have thousands of connections. So I already had this platform to make me successful as a freelancer. But starting out, you aren't going to have that many clients. You aren't going to be making very much money. Even if I charge like $95 an hour. You could probably even charge more than that. But still, even then, you're not going to have that many clients at first. And so I would never recommend for someone to just out of the gate, from grad school, be a freelancer. Because it is really difficult, unless you don't need the money. Like, I actually have a husband that does make enough, can support us, so I can do the part-time thing and don't have to worry about the money so much. But if I were relying on myself, it would be way harder. Although I do know professional freelancers that make enough to support their family. So it's totally possible. It's just, I would recommend working at a company first, getting those skills, because you're also going to learn within that company. Those people are going to edit your stuff, and then it's going to help you as a writer at the time. So I would say that maybe wait a few years after you had a job to become a freelancer, and if you're planning on that, then to really set it up so that you're going to have clients when you get out and save your money, because you won't be making that much at first.
Yeah, reach out to a freelancer and start picking up stuff. And even that, you don't make a lot of money, but at your level, I think it's appropriate for you to get that experience too, and say, hey, I'm interested. Can I try something out?
Yeah, you can pick up stuff now. Like, grad students, docs totally get freelance work now. Yeah. It doesn't matter that you're still in school or whatever. You know how to write. I mean, the thing is, you need to show them example. So start writing now. Write your own little blog. Put it out on LinkedIn. I mean, LinkedIn has a great platform for blog writing for yourself. And I use it for my own little stuff. So start writing, and then you'll end up having those examples. So when you want to get that job, that you send it to them. They will always ask for it.
Thank you.
I was wondering if you could talk a little bit about starting salaries, and if you negotiated, if there was anything that in your experience or on your resume that helped you in the negotiation process.
Terrible.
Yeah, I can definitely speak to that. You, as a medical writer, I'm just going to give you a range of what based on research, and this is completely free. You can go and get it. AMWA publishes this every year, actually. They will publish what the median salary is, and it varies by where you are. But I would say it's safe to say it's anywhere from 60 to 120 on starting if you didn't have any experience. And it could possibly be more. You'd have to look and see. But I definitely recommend whatever you get, don't just take it. It's really tempting because you're like making nothing and then you're like, what? So, but you should do your research and make sure. And I did for my position, the first thing I did is went to AMWA, figured out what the salaries were, figured out what the experience was, and kind of made a list like, hey, I have this, here's the average range, I'm gonna negotiate up.
Never say the number too. Or if you say a number, just say like the average online is this.
Yeah.
So, you know.
Yeah, there's a salary negotiation workshop that I can't remember who offers it.
It's through GWI. It's
Yeah.
Women in Science. Guys, check it out too. Like it's for everybody. It's not just.
Yeah, I went to that and they
that
said
one's
never ever give a number first. And then when I was talking with the recruiter for my current job, we just went back and forth because he wanted me to say a number.
Say the market average. What's the market average?
And so then finally I asked what was budgeted for because that was how I finally got out of saying a number, because I just felt like, look, I'm considered a trainee as a postdoc. I didn't think it was fair to
And they'll ask you
anything that was like, I'm a postdoc, I'm a trainee. That
don't give that number
be
either.
fair.
Oh yeah.
Don't give that
So I
number.
finally said, well, what do you have budgeted for the position?
Yeah.
And he gave me a number, and the number was within the range I was looking for, and was approximately twice what I was postdocs. And I didn't push back on it. I just took it. But I did not give a number first.
Yeah.
It was hard, though.
You should always try to negotiate, and the worst thing that'll happen is nothing happens, which is what happened to me. But at least I tried.
They can say no, and sometimes they can. I mean, I was very persistent. My recruiter was like, nope, this is what's budgeted, and this is what it is. And I think maybe I'm gutsy, but I actually reached out to my manager and I said, or my would-be manager at that point, because if they're
Sharing an offer, though.
if they've already given you an offer, they really want you. So then you would just say, hey, this fair price here based on my experience. I've already been with the company for a year and I have relationships with these people. And then, that actually really helped out.
You had some kind of leverage, totally, because you were there already, and clearly they wanted you. So it's a lot scarier to negotiate when you don't have that kind of thing.
But you should, because they say no.
I agree, and I took a job without negotiating and totally regretted it immediately afterward. And so I wish that I would recommend just asking for 10% more, because it's not insulting to the company, because you're scared of pissing them off, right? You're scared of them. That's why you wouldn't negotiate. You're scared that they're going to give it to someone else. They're not going to do that if you're totally reasonable about asking for, 10% more. Don't go asking for 50% more. Then that makes them mad. Then they're like, who do you think you are? This is a good job. You don't even have the experience. Then they start thinking about why they shouldn't hire you.
Yeah.
But if it's 10% and it's reasonable, then try. All they can do is say no. They're not going to remember that you tried to get more money out of them.
No, I think it's expected, and I think especially a lot of women don't, because it's the fear of oh my God, what they're going to think I'm greedy, or they're, it's
Difficult.
not about that. Your salary, your starting salary is going to set the tone for the rest of your career. So if you didn't ask for that, you're going to be paying for it for the rest of your life. So don't, your first career, just do it, ask for it. I got a base raise from what I was, and I got a bonus as well, it's totally fine. It's what's in the company. You do your research. You can't ask for 50% more, but you do your research in the industry that you want, and you figure out what is a base, what's the experience. Go and check it out on, I think, salary.com. There's a bunch of different things.
Glassdoor, yeah.
Glassdoor. There's so many sites. Do your research. You all know how to do that. Do that, and then base it off of that. Don't sell yourself short.
Sorry, I just want to share my experience. I never take a job at the price they gave to me in my whole career. And what I always say is this the best you can do? And I don't give them a number. And most time they will come back with, $2,000 more, $5,000 more, even though they already, when I talk to the recruiter, they will say, okay, the hiring range is A to B. most time they already gave me the B, which is the highest they said they will give. But if you ask, is this the best you can do, and they will most come back with something better. Or in one case, they gave me $3,000 moving expense. They said they will never pay. Another company gave me $5,000 moving expense. And one company, I asked for more vacation time. I thought they're going to give me more vacation time because they said everybody got the same. But they ended up giving me 10 days extra paid time off. I asked for both more money and then more time off. They didn't give me more money, but they gave me 10 more days time off, which is equivalent about, several $1,000s too. So.
Yeah.
Yeah,
Like,
good advice.
That's a good one.
awesome. Yeah.
So my question is like the step before the negotiation, before you get that offer. So like all PhD students, we have the same training. We probably all write manuscript or some kind of scholarship. So what do you guys think is important skills to highlight when you are interviewing for that position? Or if you're looking to hire and you're a manager, what do you look that is important to get that like different?
Compatibility with the group actually is huge. Because we're actually interviewing right now, and I was talking to my boss, who just interviewed someone, and then I said, wow, she was really overqualified. And he's like, yeah, but her personality, it doesn't fit with the group. So like, you're also interviewing them, because like, I like to think like, can I get a drink with my boss after work? If not, I don't really want to work for them. And they most of the time you hope they're doing the same thing as you. So and that's not really anything you can help though, but it's really important.
Yeah, it definitely, and I'm sure if you've taken Bree's class, you've learned this, is that you want to mimic the interviewer. I mean, not down to their mannerisms, but you want to set the tone same, so that you kind of match their level of how relaxed are they. You should try to mimic those things, those behavioral things. They're way more important than you think they are. You need to be comfortable during the interview, and I think that goes a long way in showing that you're going to be part of the group. They all come down to, can I work with this person day in and day out, no matter what your qualifications are. My boss has been quoted saying, I don't mind hiring someone who has less experience but can get along with everybody and is willing to learn. And that goes a long way. So I, definitely echo what Julie said is behavioral technique. Just getting that down, being confident in what you're doing. Another thing in terms of translating some of the things that you've learned in grad school, how to manage people. You guys have undergrads, I'm sure, that help out with experiments, and you have postdocs that you collaborate with, like just getting that language down, looking at it from that, imagine that what you're doing is a job, like what are the things that how to do. You're great at time management. You have been, I'm sure, in difficult situations, and you've figured out how to get out from there, have a good resolution, things like that. So I would just make a note of all those things and then think about them in terms of kind of not just the technical skills that you have, but the management skills you have, and even the behavioral skills that you have.
Allergan likes to use STAR, situation, task, action, result, I think. Mm-hmm. So definitely look that up too.
That's the first thing that the recruiter is actually looking for. So you'll get a call from a recruiter, and a lot of recruiters, even agencies, are looking for, can you go by the STAR technique? I've heard. I'm sure you can. But
I've never heard of that.
Okay.
I feel like I had very different interviews depending on, because you'll get a call from a recruiter first, which is they don't know your job. They don't know anything about the job that you are interviewing for. They will and that was the same with and then I had an interview with an HR person, and that it was more like, just Google common interview questions, interview techniques, and just practice some of those things. Like, I can't remember what it's called, behavioral interviews or something.
Mm-hmm. Yeah.
They're going to ask you something about remember when you've been in a difficult situation with a coworker and describe how you solved the problem, and that's when you use the STAR technique. And so, like, the more you practice interviewing, the better you'll get at it. So even if you, as you start applying for positions, if you start getting contacted by ones that you're not even all that excited about, just do the call, do the phone interview, like, get the practice. I went on an interview for a job that I knew I was really unlikely to take, but I got the practice that made me more confident, because if you need to be confident in an interview to just kind of like have your personality come through, so that they can like ascertain whether or not they want to work with you. If you're just kind of like so tight and blank, then they're just not going to feel a connection, and they're not necessarily going to feel like they want to work with you.
So how did you go from writing up your resume and finding a particular job, because it is so out of what you did before and like totally not even what you did in your at all? So like, how did you find that job, and what did your resume look like? Did you write a cover letter? How did you get that job? It seems odd that it was,
I know.
so different.
So there was an AMWA networking event that I attended, and somebody that, Amy Chung, who was on a panel discussion at one time, who I was asking for advice, was at that networking event, and she said that she heard Edwards Life Sciences was hiring for this position. Like, I never would have looked at it or thought about applying for it, because that doesn't have anything to do with like my area of expertise. I don't know anything about medical devices. She was like, oh, you should apply. So I did. And I think I had at one time asked her to look at my resume. She did help, like, because you need to craft a completely different resume than what a CV looks like. An academic CV is a completely different document. It serves a different purpose. So I can't remember exactly. I mean, I have a better resume now than I did then as far as the way it's organized. But you need to have it organized in a way that's like highlighting skills, that's highlighting things like what I told you that I can. At the beginning of it, you're showing about all of the writing skills that fit with the documents that they're going to ask you to create. So at the top of it, instead of maybe at the top of a CV, it might have your education, something like that. The top of your industry resume needs to have a skill. In like bullet point.
It should be a targeted.
Like, I can write literature reviews. I can write manuscripts. I can write, instead of in industry, we don't usually say data presentations. We call them slide decks, something like that, right? I can write slide decks. All of the things that you've written. I can write protocols. I can write, this sort of stuff. And I'm not honestly sure, like, exactly why they decided to call me in, because it didn't say anything about cardiology or knowing anything about heart valves.
Well, that's the thing about writing jobs, and like she said earlier, is that they are in demand, and there aren't a lot of writers out there. So they're willing to take a chance on people who haven't necessarily had writing jobs before, or who are in a
I had some programming experience. That was one thing they said. There was I did some programming in R during my postdoc, doing a bioinformatics, and I work really closely with programmers right now, because they are the ones that I'll run all the biostatistics. So that was what they did say. They said, I noticed on your resume, it said that you had experience in R, which is really common for biostatisticians. They want to make sure that you understand statistics, because it's really important to understand the way that you're analyzing clinical data. That was something that jumped out in my AMWA membership that is like at the very bottom of your resume, where you put like affiliations, clubs you're members of or something.
No, but
like
I always
guess we're going to take you seriously because you're a member of AMWA.
Yeah, don't leave anything off your resume. I mean, everyone says, oh, make like a 2-page resume. My resume is 4 pages, and I'm fine with that. The first page is where the meat is, like she said, bullet point your skills. You want to have like 5 of them on the top that apply directly to that job that you're applying for. And then I have education next. You don't have to, but like at this point, it's important for us that we have PhDs, because we're not just relying on that experience, right? So you want to put your PhD, and you want to write a summary about what you did in lab as if it were a job. They're not just like what you found. They're not really going to care what the results were. They're going to care that you performed this many, PCRs on this type of machine and blah, blah, blah. You know what I mean? Like, you want to put sort of more skills under there as well. And then I say put your papers on there. I mean, don't make it completely opposite of a CV. I think you should still put all that stuff on there. Any of the clubs or whatever, like put GPS-BIOMED. Somebody at the company might have also known about, I was on them. like anything you don't want to miss, because what if she forgot? What if she didn't put that she had known R or coded, which is random, which she might not have known was important to that job, and she left it off. They might not have hired her. So like that, I say just put everything on there, just in a nice, organized, concise way.
I don't have my publications on. My resume is 1 page, and it just says 8 peer-reviewed publications.
Sure, and you can do that too. You can
Yeah.
No, but like I said, I don't think there's a right or wrong way to do a resume, except for if you don't put those skills at the top. That's.
I'm going to give a shout out to the PhD program, which I don't know if you guys, or you might be.
I was there that's when I started, and as you all know, we are really scraping the bottom of the barrel for GPS-BIOMED, so we may not have enough funds to do it this year, but we'll see if we're able to get some funds. But that's one course which I've heard everyone benefited a lot
That
from.
was really helpful. They have an Excel sheet where it's put your application or put the job posting there. You want to echo some of the words that are in there. Because you're going to get screened. Your resume is going to there's a 90% match on this, and that will actually sit on the hiring manager's desk. No one is looking at your application. It's a lot of the times done through a computer. The only way you have somebody look at your application is if you know somebody at the company and they say, yes, hey, I'm going to go talk to that hiring manager, which I highly recommend you guys all do that. But if you're just gonna go ahead and do it through LinkedIn or through Indeed or whatever, then you need to, hit all those words. And don't send the same thing, that you would for a research job, for a writing job. You got to think about, what's the focus here? You have to change it. You have to change it for every job. Not even 2 research jobs. You're gonna send the same resume. You're not. You're gonna need to tweak it for the specific words that are in there. And that's how you're going to get calls.
It's called a targeted resume.
Yeah.
You could still look it up too. But I learned that at PhD too.
Yeah.
So great. So in the interest of time, maybe I can, if no one has questions, does anyone have any?
Question that
Yeah, so I do have that last question. So since we started late, I'm not going to stop right now. Maybe one last thing I'm going to ask, and then we can wrap up, and then I'll explain how we're going to go around doing the networking part. But there was one question which, Kristen, did somebody bring it up, or you thought we should discuss? One of the biggest fear I think people have is if I get into a medical writing or science writing position, am I closing my doors to go back into what I've been doing for past 7-10 years? Because that's the only thing I know, doing research and bench research. Is that true? What do you think about all of you? Would you go back?
No.
I don't know.
You can still. I have a friend who was working in, what's that company? Well, there's a company near Diamond Jamboree or whatever. Think of it later. Anyways, it's an industry company, and now she has a professorship at Cal State University San Marcos. So
How long was she at the company?
she was a scientist, and she was at the company maybe for 5 years.
Right, but she was a scientist.
She was a scientist.
So the
yeah.
question is really about, if you go into writing, can you go back to being a scientist later? Or what doors in general are closed for you after you've decided to be a medical writer or what?
Well, if you are in a company, the company encourages you, if you want to move out to something else, the company encourages you to branch out. I'm actually looking into a more medical affairs role right now, which is different from publications. They highly encourage you to do something else.
There might be a different point from academia, if take a detour, but I think you've been it, guys. I think that, you're fresh out of grad school, you wanted to try this, and you can say you learned a lot. You learned how to look at clinical data. You work with biostatisticians. You got an appreciation of what the job was for, but you think your place is,
Yeah, and I can say you can do that after 2 years of being out from the bench.
Yeah, you can't go.
That's what I'm kind of getting at, is once you're sort of
can.
here for more than 2 years as a writer, or whatever, go into marketing, those people don't go back and become scientists. And I don't know if it's because they don't want to or it's because they can't. I'm not really sure. But I think because, well, I don't think you really can. I can't see someone getting hired if they've been out from the bench. Because that means, well, why did it take you so long to get back? They're going to start asking you questions. But like you said, if you're just doing it and trying it out and you realize within a year that you don't like it, that's another thing we should talk about is if you don't like your job, quit. Don't ever stay in a job that you don't like. And so, yeah.
Finish your PhD, please.
Finish your PhD. Yeah, but like that's what you learn from your PhD too. After that, you do not have to stay anymore, right? Leave. And so, yeah, so find something that you like to do. And like I left one of my jobs after 5 months, I left a different job after 8 months, and then I left another job after a year and a half. So it's like I've been jumping around a lot because I haven't necessarily found exactly what I want. But I'm fine with that, and I feel like there's still, I can still start my own company. That's kind of what I want. That option is always open, I guess.
But, I mean, it's this question you always ask yourself anyways, like, do I want to stay on the bench or do I want to do something different? Pipettes give me PTSD.
Me too.
So I already know I do not want to go back to the bench.
So that sort of brings me, like, maybe that was one question which I really want to ask before we end it and go to the next one. Academia is very brutal when it comes to work-life balance. How is it work-life balance in your role, especially if you could describe a little bit on freelancing roles and then the other roles and as a publication manager?
Well, the freelancing is great. There's work-life balance. I have way more life than work. But that's because I choose that path. So I don't try to solicit lots more clients and get more work because it's just not that important to me. I'm just trying to keep up my career until I have kids and stuff, and then I kind of want to focus on that. So, it's something I decided on my own, but it's great for work-life balance.
Yeah, my work-life balance is great. So, I'm remote 2 days a week, which was one of the, after I'd been there for a year, I decided I was either going to ask for a raise or to be able to work remotely. And then I decided that's more important to me, and then they gave me a big raise anyway, so good. And on the days that I do commute down, because I live in Long Beach and work down here in Irvine, they're also really understanding with I'm going to work from home a little bit this morning and come in when the traffic dies down. And you'll never find me there after 5 p.m. So won't find me there before 30. So it's great. Yeah.
Yeah, I have to say it is a really good work-life balance, but it depends on what kind of person you are, and what drives you and what's important to you. There are days when I'm on at, 6 a.m. and I am still on at 9 p.m., just because I'm invested in, what I'm doing and I just want to get it done. And that's even after I've had a kid, so, it really comes down to what you want. That's not what Allergan, is all about. It's a very good work-life balance. There are days when, if I've had those kinds of days and be like, you know what, I'm going to do a half-day Monday or whatever. I need to take my kid in for vaccinations. I can't make it this day. I'm going to work remotely for 2 weeks because I'm working on this really, big project, and I, don't want to be in the office and lose 2 hours each day in traffic. I live in South LA County, so I do not want to do that commute. So I usually, will drive in either really early in the morning if I have to, or, lunchtime or something like that, just to kind of facilitate, what works best for me. So, it's up to you. You are driving that. And I think medical writing is that type of job that you can work as much or as, to an extent, to as little as you can. You have deadlines if you're fulfilling them. It doesn't matter if you want to do your writing 3 a.m. That's fine, and I think that that's understood everywhere across the industry. But if you do interview for this, you do want to ask them about this, because some companies are still kind of old school and rigid about things. So that's one thing that I recommend you guys look into when you're applying.
Even within the same company, like,
Yeah.
you know, there's like little micro environments, manager to manager. There are some managers that are like, no, you're never allowed to work
Yeah.
remotely, and we always want everybody sitting at the desk from 8 to 30, and like, so, yeah.
Yeah, so it depends per company, it depends per group. In terms of Allergan, I think most of Allergan has pretty good work-life balance, and I like that. Like, we had a town hall the other day, and all of our leaders showed that family is number one for them. So that's really cool that like they stress that. I live in Irvine and I work from home like 3 times just because I just don't want to get out of my pajamas. I don't have a commute.
It's the best commute.
It's
my bedroom to your office.
It's 5 minutes from my house to Allergan, and I'm like, nah, not today. So, but it also depends per group. Some groups require you to be there all the time. Some groups let you work from home when you feel like it. We're lucky enough to have a boss that says, just as long as you get your stuff done, you do it well, I don't care. But in general, compared to academia, definite better work-life balance. I don't work on the weekends. I try not to work past 5. It just depends because I have a global position, so sometimes I have to work past 5, but that's because I'm on a call with like China or Singapore, or sometimes I do have to work in the morning, like at 6:30. Because I'm on a call with like Europe, but then at that day I'm like, can I stop at 3 today? Yeah, okay, I'm gonna stop at 3 today since I started working at 6. So it's very flexible too.
I'd say in the beginning when you do get a job, kind of test it out, see how it is first. You know, don't be like, all right, peace. You know,
Yeah.
guys later. Like
You do have to
See what other people are doing.
FaceTime is really
you have
important.
to show face
Yeah.
in the beginning, but if you've been it for a while, then you're
Once they
like, eh.
trust you,
Yeah.
fine.
Well, thank you very much. This brings us to the end of panel discussion. If you have not been able to ask questions,